Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Welcome to Monday Q&A. This is the place where I answer you direct and specific questions as long as they can be generalized to the public. And for today, I randomly selected 6 questions in my Q&A queue based on the orders that I have received them. As always, I blocked out everybody's name. If you do have a question for me that is specific to your situation, please email it to me. My email is info@drzphd.com. The email will be linked below in the description box. There's going to be timestamps below so that you can click and navigate the subject matters of your interest. So let's get started. I'm excited to see what are today's 6 questions going to bring. I haven't had a chance to read them, so let's read them together. Question number 1. Hey, Dr. Z, I wanted to start off by saying I'm eternally grateful for the content you make on YouTube. You are so welcome. Your videos help me a lot with my transition. That's exactly what they're here for, to help all of you. I have been out publicly as a transgender woman for about 5 weeks now and a month on hormones. For the most part, it has been great externally, and I have been accepted at work even though I haven't legally changed my identity yet. I know what's most important is that I feel good about myself, and I do. I truly love myself now, whereas living as a man often gave me thoughts of suicide. I'm so sorry to hear that. I'm 30 years old, so I have a lot of physical attributes of a male that I didn't think hormones alone will fix. For this reason, so I often get ridiculed in public for being myself. I don't like confrontation, never have, but more so now as I'm much more emotional than before. Do you have any advice for how I could address these people, or should I continue to try my best to ignore their ignorance? So this is a really important question. It's a big one. You're 30 years old. You just started. You're very early in your transition. You said 5 weeks. If you've been expressing yourself publicly in your female self for 5 weeks and only a month on hormones. That is very, very early gestation stages. Congratulations. I'm glad you're already feeling so much better and so much more connected to yourself. So that's the first thing to recognize is how much more affirming the steps have been for you. Now, I'm gonna let me present 2 scenarios, and depending on where you find yourself in, you can go with one or the other. So the first scenario is when people start out to transition, when they start out to embody their authentic self. And when they're in such early stages, I'm going to throw out what I usually recommend and what I have seen and witnessed that has worked really well for people. What I usually recommend is starting out with social transition, which sounds like your early stages of doing. And while you're socially transitioning, being on hormones, a lot of times social transition is very, very, very small for individuals. And this is so small for reasons to prevent the pushback that you may be getting, the harassment, the stigma, the negativity that you might get that may shatter you. So social usually, when I work with people, is very, very tiny. It's almost, if you identify as a woman and you're shifting from a masculine presentation, it is often starting to shift into more androgynous presentation before you move into the feminine presentation, if that is a presentation for you. All the while being on hormones, because hormones alleviate the psychological distress. Additionally, they start kicking in changes and just overall make you feel good. So this is my first suggestion. Now, the reason why I'm suggesting this is because I don't know where you stand. I don't know if you're aware that you could just start so slow in terms of androgynously presenting and gaining confidence, gaining assertiveness, and then pushing the envelope until you reach your full presentation. Sometimes people don't know this because they're not working with a gender specialist, they're not working with therapists. And so sometimes people just say, okay, I know that I'm a trans woman and I'm just going to go ahead and start presenting, which is, again, if that works for you, that is great. Know that my suggestion is just my suggestion of what seems to work in terms of psychologically preparing and easing people into their authentic self. and all of this is only because we live in a society that is negative. We live in societies that is very binary, that is very judgmental, and that is outright can be very abusive and toxic. So for that reason, those steps exist to ease things in. And many of you who have gone through transition will know how essential those things are. Now, again, if you're the kind of person who doesn't really care, who can deal with the negativity and just want to, just from day one you became aware, present as you are, go for it. More power to you. Again, please keep in mind that my suggestions are there because primarily of how society is structured. So now you other part is, if you are that person, if you're the person that you just want to fully express yourself, you don't want to ease in, you don't want to take little baby steps, you just want to go all the way to the deep end of the pool. Again, that's great, whatever works for you. Then how you can adjust and cope with what you already mentioned, the negativities that you're getting back, the influx of push that you're getting back. That can be very difficult. I have seen even the most resilient and strong people with the most biggest support eventually reach their breaking point, because there's so much psychically and psychologically we can handle. No matter how strong we are, if you go out every day, and if every day even once you get some kind of negativity or misgendering or some kind of negative energy in your direction, and if that happens every day, that accumulates. When that accumulates, it ends up, unfortunately, reaching a breaking point in you. So my suggestion is, see which, if you absolutely have to fully present, fully embody yourself right now, immediately, then just utilize support, get connected to your community, find the buffer when the difficult times happen, when you can't handle it anymore, you have that supportive system in place. If you're listening to me right now and you're realizing, oh, wait a second, I didn't realize I can take it a little bit slower, I can do these little steps, then dial back. Remember, again, as I said, all of the things are here in place, again, primarily because of how society is structured. For a lot of people, it helps tremendously. They start with hormones, they start feeling good, they start feeling the changes. And as they start doing other things related to their transition, maybe they're starting on electrolysis, starting some other things that maybe bothers them and gives them dysphoria, all the while pushing the envelope, pretending androgynously, pushing envelope even more. With each envelope push, their confidence grows. And by the time they're ready, it's not that they're in a place where people have achieved, if they're striving for possibilities, they achieved passing. It's not about that. It's just that they're in a mental place where they're feel better, they're confident, they have done these little steps. They're much more better to handle everything else. So think about that, whatever works for you. Again, neither one is necessarily absolutely right or wrong. This is just a way of doing it. There's so many ways to go through gender transition. Others listening, comment below, share what worked for you, what helped for you. I know for a lot of people, little steps help at first. It's little steps of expressing yourself, and then expressing more, and expressing more, and then finally blooming into this beautiful flower that all of you are. So that would be my suggestion, and I wish you all of the best. Yeah, wish you all the best. Also, I want to mention what you said here is that I'm trying to see, you said something about here. You're 30 years old. You said, I have a lot of physical attributes of a male that I don't think hormones alone will fix. You'd be surprised. Hormones are not magic, of course not. But a lot of times people fixate on particular attributes they have, and they don't allow room for possibility of thinking how things are going to unfold. Again, hormones are not magic. They're not going to magically turn things 24/7 around. But what I want all of you to keep in mind is that the way we gender people is, our brains are programmed socially and culturally to look for particular gender constructive markers. When a person has enough of those markers, our brain immediately tells us automatically, it happens in milliseconds, if we're looking at male or female. This is why for non-binary folks it's so difficult, because there's not enough markers yet. So for a lot of people sometimes when they start transition, they think, oh, my goal is to pass, if that is the goal, and I have to absolutely look like this gorgeous whatever. And the reality is that no, you don't. It's a combination of these little markers that sometimes all present a cohesive picture for somebody's mind. That's just how things happen. That's how brains operate. Don't be what I hear is you being so hard on yourself. You're so early on hormones. You don't know how hormones going to affect you. You don't know how your body's going to metabolize hormones. You don't know how things are going to unfold. So give yourself time and be kind to yourself. The most important thing is how you say, I truly love myself now. That's beautiful. This is what it's all about. It's about waking up and liking and loving yourself. Great question. Question number 2. Hello, thank you so much for all your compassionate and helpful content. And I'm sorry that you get hateful comments for your support of our community. Comes with the territory, and believe me, it is nothing compared to what a lot of you, if not all of you, get. Yeah. I have 2 questions about coming out at later age. I'm 43 and have yet started to come out to people as trans masculine. One, so you have 2 question parts. The first question for this segment, the first question is, how do I deal with people who act like my being trans is some kind of tragedy? Sorry guys, I have hair stuck in my eyelash probably, and it's driving me nuts. Some kind of tragedy. I'm guessing this is going to be related to family, because it is often the family that is, oh no, it's a tragedy. You found yourself, and you're 43 years old. Family can be so dramatic. Like I'm not. Like I'm announcing that I have cancer or something. Exactly. I mean, it's like drama, it's your life, you're an adult, and yet everybody around you is falling over like they can't move forward anymore. For me, it's one of the best things that ever happened. Congratulations. This is the first year of my life that I haven't hit, cut, starved, hated, or tried to kill myself. Yeah. I hear you. Being trans isn't always easy, but it's much better than the dissociation and self-harm I was living with before. Yep, you right there. You just see it. It's all worse. Just starting to regaining your health and your sanity. So it's really painful when people react by saying, "Oh gosh, that must be really hard," or ask my husband, "Oh no, are you guys okay?" Yeah, they're projecting. Remember, every time they do this, people projecting a lot of their own stuff. It has less to do with you and more to do with them. These people are family and friends, but they never noticed or cared about my suffering before. And now that I found what was wrong and I'm fixing it, they act like it's tragedy. How can I respond to this without overwhelming them with a huge, long story of my past self-harm and other problems? Especially since this feels like it will encourage them to keep thinking of being trans as some kind of disease. Whew, loaded question. First of all, good for you. Good for you of figuring out what's happening. Good for you of getting a hold of dysphoria, dealing with it, even though you acknowledge it is so hard. It is still, you acknowledge so much better in retrospect to how it was before in terms of coping with it, all the negative coping, self-harming, things you mentioned that come along with it. Good for you. In terms of how to deal with individuals, like I said, family and friends are often the ones who are like, oh no, the tragedy, and oftentimes it has to do more with them because they are adapting to change. They don't like the change. Now they have to relate to you differently. Now they have to, things in your relationship with them is going to change because you're also shifting and changing, and people don't like change. So they push back against change all of the time. So this is one of the reasons why it's happening. I understand how do you handle this without necessarily overwhelming them with your story of self-harm. Well, how about just being very clear and just letting them know, I notice that you guys are sometimes treating this like it's some kind of tragedy. And trust me when I say this is the best thing that could ever happen to me. And before this, I was really suffering and struggling, which you may have not even been aware of. So I would appreciate that instead of acting like it's a tragedy, if you just, pull back. Trust me, I'm handling it. My life is better. I feel happier. Trust that what I'm sharing with you is a good thing for me. I would just lay it out like this, and hopefully they will acknowledge it and stop treating it like a tragedy. But it is so common for family and friends to treat it like a tragedy, again, primarily um, because they don't like the change that is happening. And another thing that is happening, why is it treated as a tragedy, is because they hear so much stuff in the news, and they're inundated with ideas that and misinformation that a transition is the worst thing a person can go through. So now they're wondering whether you're going to be worse off. Hopefully, with their over dramatized tragedy, hopefully, ideally, they really have heart in their mind. They really have good intentions and they really do care. So it is. I think in retrospect, it's better to have somebody who is over dramatized concerns than somebody who just doesn't want to support you at all. But I would just have that conversation. And I would just tell them, trust me, I'm much better off. So stop acting like somebody just died. Nobody has died. I'm not dying from cancer. I'm thriving. I'm not dying. And yeah, good luck with that. Let us know how that goes. And your second question to the segment is, do people have a right to keep treating me like an old version of me just because they knew me before? To me, the person I used to be was always an act, a false self, and now I am the real me and feeling so much better. But people say things like, well, I have a trouble not thinking of you as a girl, or you can't expect me to learn a new name when I've known you as old name for so long, or whatever. And it makes me feel like I'm asking too much. Sometimes I even feel like it's my own fault for tricking them by passing as the other gender so well for so long, even though that felt like a matter of survival. What is the best way to deal with it? This is a great question. A lot of people have the same question, how to deal with this. My best suggestion for you is, do they have a right to keep treating you? It's not a matter of really right. It's a matter of mindfulness and respect, in my opinion. In the beginning, when the longer you've known people, let's say, put it this way, the longer you've known people, the longer it might be sometimes harder for people to adjust. Nonetheless, there's the period of time, I always say, if people truly are trying, there's a period of time you give them to adjust. And then past the period, I'd say, I don't know, 3 to 6 months, past that period, in my book, there is really no excuse. It's really about mindfulness. It's really about respect. It's not that difficult. It's really not that difficult. We're talking about name and pronouns, and there's no excuse for that. So it's not that they have right, it's more about mindfulness. A lot of times people who not very mindful, they will use that as an excuse for their behavior, an excuse for feeling guilty, that, well, I've known you that long and it's taken me time. No, it's not that difficult. It's not a rocket science. Going from Natalia to David is not, I'm sorry, I'm not asking you to do complex geometry in your headspace. You're not doing calculus here. You're not jumping hoops. I understand you're going to slip up now and then because you're accustomed to it, but at some point that slipping up has to stop. And you need to rehabituate your brain, how you see me, and it's not that difficult. So don't feel guilty. You're not tricking anybody. You evolving, your life has changes, and people around you needs to evolve as well if they want to keep up the relationship. So the best way to deal with it is you can just tell them again like that, hey, it has been, I noticed it has been 6 months, or I don't know how long it has been for you. And it's really, if you cannot properly gender me or properly call me by my name, just don't use my name at all. Just don't use my name. Don't refer to me by my name at all. Just don't. And don't gender me at all then, if you can, if you're struggling with it, because it's really not that hard. And that's the best way to deal with it. Sometimes people have to go more drastic ways, limit their interactions with those individuals. I don't know if you want to go that route. That's all very personal, but yeah, it's not on you. It's on them. After some point, I say, come on, it is not that difficult. Okay. And I'm telling you this as a cis person. Sure, I'm a therapist. I work with a lot of clients, but still, I get people's name correctly immediately. It's not, and even friends. I have friends who have transitioned, but I've known them. Yeah, it's all mindfulness, and that's all it is. So I wish you all the best. Great question. Question number 3. Hi, Dr. Z. Many thanks for your continued support for everyone under trans umbrella. I much appreciate it. You're so welcome. Sometimes when I read the questions, I wonder if you read my mind when you select the next batch. No, I randomly select them. I don't even read them. This is my first time reading them. I see and read a lot of comments from people on Quora who comment how they started wearing clothes of the opposite gender in their early teens. They then often go on to describe their love for cross-dressing throughout their lives. I also read about some people knowing their inner gender being female or male or something else and terrified identifying themselves as trans. My question is, what are your thoughts on how to figure out the knowing part? I don't actually know what it means to know my gender is female. I recognize the cross-dressing part, but without some way to decipher the knowing piece of the puzzle, ongoing confusion reigns. I'm sure I won't be alone with this question. I hope it makes sense. Many, many things. Great question. So this is a really common one. It's so common that um, under my services, I offer clarity sessions, which are like 1 to 3 sessions for people who just want to like immediate clarity from a specialist, what's going on. And this is number one question that people come see me for. That has to do with primarily cross-dressing, and a lot of times, if not all of the times, it has to do with cross-dressing and it has to do with sexual arousal. And the question often goes like this. I don't have a history of gender dysphoria in relationship to my gender assigned at birth. I feel pretty neutral or okay about my body, but when I was young, I feminized or cross-dressed, and it brought me sexual pleasure, and I continued to engage in it, and it continued to give me sexual pleasure. And at first, it was primarily for sexual pleasure, and now I'm wondering, could it be something else going on? Now I'm wondering, could I be transgender? Oftentimes, within this narrative, a person doesn't feel any dysphoria. They feel, again, neutral about their body. They don't necessarily have a desire to be opposite gender, but they're starting to question it. And then they go on the line and the Quora, and they see accounts where people say, if you are engaged in this behavior, you're definitely trans, which is not true. How to figure out and know what's really going on. So two things could be going on. Let me first explain two things that are going on. One thing that could be going on is people engage in this behavior primarily only because it's sexual, it feels good, and because they establish a sexual linkage to it, the behavior continued. And the more you engage in this behavior from childhood into adulthood, the more you solidified that link, and the more that link became about something that feels good to you. Because we live in a society where this behavior is considered to be taboo or negative or bad. Every time as a child and into adulthood that you engage in this behavior, the minute you stopped masturbating or whatnot and feel good, you immediately probably felt guilty. 99% of people do. Immediately they start feeling that, oh my God, something is wrong with me. This is a lot of times narrative. This is sick. This is not okay. I shouldn't be doing this. What the hell is wrong with me? Why am I doing this? So in other words, as sexual behavior that is normal and natural and harmless and consensual within oneself starts to turn into a behavior that is prohibited. And then once you start questioning, what the hell is wrong with me? Something got to be wrong with me. You turn that inwards. The more you ask yourself every time you engage in behavior, and afterwards, the more you ask yourself, what the heck is wrong with me? Something is wrong with me. The more you implant a seed of confusion, a seed of that something is got to be wrong with you. And sometimes that seed grows, and eventually I see adults who have that seed that got blown out, and now they actually do experience gender dysphoria. In this way, the gender dysphoria and the gender identity has started to model together in a sense that a person's gender in regards to their gender assigned at birth has never had a chance to solidify, because every time you would ask yourself these questions, you would basically not allow it to form. So as a result, sometimes people do actually feel dysphoria to the extent where they have to go through transition. And now this is how their gender identity got formed. Remember, gender identity doesn't just get formed with early incongruency in childhood. It can be formed even through this linkage. And then there is another group of individuals who have engaged in this behavior, continue to engage in this behavior. It's still for sexual pleasure. Sometimes it gives them peace of mind. They feel neutral, no dysphoria, don't feel uncomfortable about themselves, don't have desire to be of any other gender other than they are. But they're starting to question what might be going on. If you fall now in this category, just starting to question what might be going on, again, realize that part of the questioning is that you have um, what am I looking for? My brain is now having a biggest brain fart. You have now associated the sexual behavior to something that's taboo. And again, you're thinking something is wrong with you. Now you came across this material in quota form, and now now this is the answer I've been seeking since childhood. Since childhood, I've been saying something is wrong with me. So I always go back to distress. What is the level of distress in relationship to gender dysphoria? Is there gender dysphoria present? A lot of times people will say, I have no distress, I have no gender dysphoria, I'm just trying to figure myself out. And a lot of times just understanding that you made this link, but in reality, this is just sexual behavior you enjoy and there's nothing else to it, can really be helpful and insightful. A lot of other times, just really knowing is to sitting down and dissecting those things and asking yourself those important questions. Well, how do I feel about my gender assigned at birth? How do I feel about my body? How do I feel about body parts that communicate secondary sex characteristics? How do I feel about being gendered based on my gender assigned at birth? How do I feel about when society and people look at me and interact with me based on my gender assigned at birth? What about this cross-dressing behavior? What about it that feels good? What do I enjoy the most about it? Do I tend to cross-dress primarily for sexual pleasure? Is it usually something that once I'm done and I enjoyed it and I got a pleasure out of it or sense of calm? Is it something that I just have no problem putting away and continue living without any distress? All of those questions are going to be important, and all of those questions are going to lead you to finding out more about yourself. It's not a very clear cut, yes or no. But this is how a person derives at the knowing part, is that asking those questions, what they mean to them. A lot of times sexuality our sexual preferences get very modeled if we are constantly asking ourselves, something gotta be wrong with you, something gotta be wrong with me. Again, a number of people I have who ask me this is a lot, and I really think this all needs to be normalized because it's causing so much gender confusion for people who otherwise don't have gender incongruency, and it can be hella confusing. That's a very common one, very, very common one. So engage with those questions. If you can see a therapist local to your area, that would be very, very instrumental, a gender therapist to help you unpack all of this. Because it's not a clear cut, but asking yourself these deeper questions. What are all those things mean to me? A lot of times people come to me trying to understand, and they have never asked themselves these questions. What does it mean to me? When I feminize, how do I feel? What about it feels good? Do I envision myself living my life as a woman? A lot of times the answers are very revealing. So start digging deep inside and you will derive at knowing or some sense of knowing. So that's what I would recommend. Great, great question. Question number 4. Okay, just checking time here. Question number 4. Hi, Dr. Z. First off, thank you so much for the channel. I have watching for a few years now, and your content has been nothing short of life-saving. You're so welcome. This is exactly why I do it for all of you. I'm a trans woman, 57, and have been going through my traumatic time. My wife of 27 years decided to have an affair. Oof, I'm so sorry. And used me being trans as the main reason for the split. That sucks. In my opinion, affairs, if you're going to decide to be with somebody else, have the guts and courtesy and acknowledgement and accountability to break down your current relationship. That's just my where I ethically stand on those things. She has known our entire marriage and has been supportive at times over the years, but generally has had trouble dealing with her own transphobia. At Christmas just gone, she told me that she didn't love me anymore and wanted to leave me. I was totally heartbroken and devastated, as well as confused. She said it was because I'm trans, even though she has lived and partly accepted it. But I feel she has been using this as the get out clause of our marriage. We have always been inseparable, and on the outside had the perfect marriage. We both look extremely young for our age, and I guess this help her to find someone else. Even though she had been having the affair for months, I found out at a later date. I'm so sorry. That's gotta be really, that sense of betrayal is so painful. I had suppressed how I felt for many years, only coming out every 3 months or so to express myself when I couldn't bear anymore. But when my wife left me, my female self exploded out and I immediately started on hormones. They have been a godsend for me as they have took away the crippling gender dysphoria I had. I'm now 6 months into my transition and unfortunately still living under the same roof as my soon to be ex-wife. Oh no, you both live still in the same place. That's gotta be so difficult. I feel that I need to express who I am more, but I feel judged and marginalized by her. I have come out to all friends and family, largely supportive and living part time as a woman. My question is that I'm getting frustrated with myself as I keep returning back to my old self, as it's easier and safer, but it's not who I want to be. How do I get the confidence to be my true self and embrace myself fully without running away into my normal box? Oh, what an important question. And my heart really goes out to you. I'm so sorry of hearing the situation you're in. First, can I just address from my experience your fracture, your breakage in your marriage? When partners appear to be very supportive and then suddenly they drop a bomb by saying, I can't, this is not for me, to me, oftentimes it's an indication that they have been a very deep denial about situation, that they have not been upfront with themselves, they have not been working on processing their feelings in regard to transition. I'm not saying this is an excuse, but this is really why it's so important for couples early in transition to have some kind of couple therapy to work through that stuff, to process all of those things. Um, I really hope and wish that she will acknowledge and take responsibility and accountability for her feelings and how she feels. I always say partners have a right. They have a right if the marriage is not for them, if this is not for them. Um, and I think she has the right to too. I don't agree here how she's handling it. Again, an affair for prolonged time behind your back is deeply, it's a big betrayal. It's uncalled for. It's completely not okay to engage in. But what I do acknowledge is that she does have a right if the marriage is not for her. But the way she goes about it is not okay, and definitely blaming you is not okay. Also, um, what I also want to say is that you said that um, you feel like you feel like she has been using this as get out clause of our marriage. You know, marriages fall apart if people don't want to be together. One person doesn't want to be with another person, regardless of what excuses they make, whether those excuses true or not. Things are going to fall apart. What's important thing for you is to recognize that you deserve better. You deserve a partner who wants to be with you and who wants to be with authentic you, and especially a partner who can be upfront and honest with you, versus engaging in infidelity and hurting you in the end. You do deserve that. You deserve to be just in a partner who is honest and transparent with you. I know it's very difficult for you, and as a result, it kind of threw you into the spin. You started a transition, you express your feeling way better on hormones, but at the same time, there's a little bit of yo-yo happening because things are a little bit more comfortable. It could be that also you might have a fear that at your age, what if I will never find a partner if I transition? What if nobody will love me? Those things are very common to come up in situations such as this. I encourage for you to hold on to the moments and to hold on to those feelings when you do feel comfortable with yourself, when you do feel so much happier, when you do feel so much joyous, and focus on those feelings and hold on to them. And remember that person that you're walking into deserves to be loved, and you will be loved, and you have to have that possibility open for yourself. Um, Look, what I encourage when people feel like they're yo-yoing and they don't know how to not yo-yo, I always encourage, hey, remind yourself what life has been before this, what it has been like living with dysphoria. uh, you already know. what life is like with dysphoria. It's already predictable. So you can choose to keep living with dysphoria and keep living in suffering, or look here, you're taking the steps and you already feel happier. So don't give up on yourself. Commit to yourself. You deserve this. Um, you definitely deserve to be happy. So this is what I recommend, and I wish you all the best. Tough situation. I'm really sorry how things unfolded for you. Um, that sounds just really painful. I'm sorry. It sounds like you also there's a lot of hurt and pain and grievings that has to be done in regards to how the marriage fell apart. And I hope you do that. But look, you already have family and friends who you said larger supportive. That's wonderful. Lean into that. Lean onto your friends and family. Find a supportive community. Find supportive people. Find the support and draw energy from that support. And hopefully that's going to be really helpful. I wish you all the best. Question number 5. Hi, Dr. Z. Thanks for the wealth of knowledge and experience that you share. You are most welcome. It's remarkably generous of you to do so and has positively enlightened me in navigating my own experience with gender. Again, my pleasure. I feel like it's well, not that many people specialize, and you do. I feel like it's ethical responsibility to disseminate and share knowledge. I'm gender nonconforming, albeit I'm reluctant to use any term to define my experiences. I find it quite limiting more than helpful at this stage. I present as male, 38 assigned male at birth, um, and mostly comfortable with this, but have had a lifelong longing to be female that I suppressed for most of my life, until exploring more privately in the past 10 years through feminine dressing I apologize, where I've arrived to in my private experimenting is I enjoy feminine expression in private, but view no value in bringing that expression to any relationships in my life. I feel mostly proud now of having this private part of me to explore, express, but have been wondering lately if I'm holding on to coping mechanisms experimented in feminine clothing privately as a child that may no longer serve me, especially as I become more emotionally mature and expressive and allow myself to access more feminine social emotional qualities while also changing my view of what being a man means to me. Is it possible my narrow childhood views of gender meant the traits I desired for myself were unachievable so long as I remained male, leading to my gender confusion desire to be physically female? Okay, let me reread that again. Is it possible my narrow childhood views of gender meant the traits I desired for myself were unchangeable as long as I remained male, leading to my gender confusion desire to be physically female? That's, listen, anything is possible. The question is, how probable is it, given your history, your context, your relationship to yourself, your relationship to your gender assigned at birth, your relationship to any dysphoria you may have, and what the dysphoria is telling you about your gender. So I wouldn't be able to answer how probable it is for you because I don't know your full history, full context. What I would encourage for you to explore, so you're gender nonconforming, so you don't want to label anything. But you also say that you've been exploring privately, and when you do, you feel comfortable. I would encourage for you just to explore that, what that tells you. When you do engage in it privately and you feel good, what do you feel? Do you feel good? Why do you feel good? Can you define good? What about it feels good? Any fantasies come up, any ideas or fantasies about the futures that come up? What are you thinking about? When you don't privately explore, do you experience any distress when you are not exploring? Do you experience any incongruency or any kind of friction with your gender assigned at birth, with how people gender you, with how people see you, with your role, with your expression? I feel like you need to dive in and explore a little bit further, because your question is not something that I'll be able to answer for you, because again, I'm missing so much from it. And I don't think if anybody will even tell you what, again, anything is possible, but we're going after how probable actually it is. So dive deeper, explore. I feel like you holding intuitively, it feels like you're holding yourself a little bit back because sometimes when we are resistant, we're afraid what we're going to figure out, what we're going to find out, because we know consciously, cognitively, what kind of changes might come with that awareness, and we don't want those changes. But as I always say, what we resist persists. So I encourage you just to be open, exploratory, and dive deeper into yourself and into your spheres of those things in relationship to yourself. So that's what I would recommend, and I wish you all the best. Question number 6, last question for today. Recently, I become concerned that my regular dressing up might be causing some changes to my heterosexuality, which is deeply concerning. Okay, I'm reading it. A little background. I'm straight male crossdresser who cross-dresses in private and would prefer to keep this part of me hidden from everyone, unfortunately, even my family. I'm a unique, this is interesting. We have amazing, like I always say, how the 6 questions I pile up have a lot of things in common. I am in unique circumstances where I am able to dress privately at work most days, but only since the last 2 years or so. So has this been possible? Am I overdoing it? I dress several times a week now, and lately I've started to notice certain feelings when seeing some guys on social media, not porn or anything like that, just normal guys. And I've started to notice things about me that feel attractive to me, and this is not good for me. I never experienced that before, and I don't want those feelings. They're not constant, and they're not feelings that I'm obsessing over. I don't think about these guys later or anything, but in the moment, these feelings can strike where they didn't before, and it has me concerned that I may be damaging myself with my frequent cross-dressing. Is this even possible, or is something else going on? Of course, as I said, these feelings are unwanted, and I want to stop it from happening. So it's actually quite distressing to involuntarily feel something against your wishes. Okay, so lots of resistance in this one. Cross-dressing behavior can change your sexuality. It can only reveal what already has been there. It's just, this is what it is. Sexuality is something innate. It evolves as we evolve. When people transition and they evolve closer to their authentic gender, their sexuality may evolve in relationship to proximity to the close to their authentic selves, but it can just suddenly change your sexuality. All of these things that we engage in, for a lot of you, it is feminizing, it is cross-dressing, it is some other sense of embodying the self. All of the things reveal something. They may reveal that there's gender incongruency in relationship to core gender identity at stake. It could reveal that all it is that normal sexual propensity and behavior that you enjoy. It could reveal that maybe you are actually organized sexually as perhaps inclined towards a man, or maybe you have bisexual tendencies, very inclined toward both genders. It could reveal so much more about you. I again, I highly doubt that the cross-dressing behavior is messing with your sexuality. Again, it's probably bringing and elevating something that's there. The question is it tied to when you embody the femininity, when you cross-dress? What could that desire to find men attractive is telling you about yourself? And I don't know where you're at in terms of understanding your full scope of your cross-dressing behavior. Is it just behavior? Is it actually tied to your sense of self? Is it actually your gender identity? For a lot of people for whom this is tied to their gender identity and this is who they are, but they still do it in private because they're not ready to be out to anybody, their family or friends or otherwise. It is oftentimes common for people to seek and desire to be sexually perceived, to be sexually desirous by the opposite gender because it validates their sense of identity. Sometimes it is people desiring that particular gender, again, because it also validates their sense of identity. There could be a lot of things here that leads why you suddenly look at the man and you feel attracted, but I hear so much resistance here. You're so adamant, sounds like, to hold on to heterosexual sexuality, and Again, remember, what we resist persists. The more we resist, the more it's going to persist. We cannot keep parts of ourselves hidden. They're bound to come out. It's not about keeping them hidden. It's about once we realize what it is, only then by knowing and acknowledging what it is, can we take healthy, productive steps in how to deal with it. And for you, you have to ask yourself, what is the soul telling me? Could it be that I am bisexual, period? Could it be that I'm strictly attracted to men? What is it all telling you? And that's something to explore here and to dig deeper. It's not a black and white answer, but I would definitely say that the cross-dressing behavior is not changing your sexuality. Again, it uncovers what is already there, but I just don't know what it reveals for you. Is it revelation in regard to your authentic gender? What is it then? Is it revelation just in regards to your sexuality? Who knows? So I would recommend a little bit more digging. I apologize. Some of the questions on here today do require a little bit more digging. This is just the nature of what we're discussing here. It's complex. It's not so easy. It's not super cut black and white. But I really encourage everybody who is listening and everybody who asks these questions to not resist. I know it's scary and terrifying, but it's better to know. So remember, if you don't know how to approach it, you don't know how to deal with it, you don't know how to healthy cope with it, you're just going to continue close that lid. And the more you tighten that fuse, the more pressure you create internally. The more pressure created internally, the more likely that is about to blow up. And we don't want things to blow up, because that's when things become really difficult to deal with. So comment below, share what your thoughts are. If any of the questions sound common, what is your feedback to individuals, what kind of support you want to offer, and I will see you all next time. Bye.